President Trump said it earlier this evening. The gradual reopening of America is already underway. Joining me now to talk about that and more, one of the newest members of the Trump administration team, White House Press Secretary Kayleigh McEnany. Kayleigh, happy birthday. Thanks for being here.
Thank you,
all right,
Judge.
Kayleigh, you're welcome. The president talked about the gradual reopening and talked about Texas and Vermont. Why those two, and what can we expect after that?
Well, the president has set the parameters to reopen the country. It's important to know this is in line with medical experts. I've been in the task force meetings. I saw them come up with these guidelines. He's eager to reopen the country. And as he has said, 4 weeks, I can do two things at once. I can keep the health and well-being of American citizens first and reopen the country and unleash the hottest economy in modern history, which President Trump put together. And Texas is taking steps. Florida is taking steps. And these states are moving forward because it's the right time to do so, as the governors have decided.
Okay, and you know, speaking of the governors, Governor Cuomo is saying, you know, we need money from the federal government. We need more from the federal government. I mean, what is the president or what is the federal government going to do in terms of individual states like New York?
Well, first, let's go to the Constitution and the way that governing works. And the states are supposed to take the lead on having ventilators and testing and supplies. But nevertheless, despite the fact that it's the responsibility of states, this president has stepped up. This president, when New York was saying we need 40,000 ventilators, 37,000 ventilators, President Trump sent tons and tons of ventilators. And in fact, so many that New York is saying we actually don't need these. And they're sending them to other states. Right. As Washington has done, right. As California has done. President Trump stepped up, despite it being the state's responsibility to stockpile.
Okay, and you know, the president also stepped up in record time, and the Democrats and the progressives and the mainstream media said it would never happen, and that is by bringing the naval ships in and actually dredging its way into the pier in New York, and yet those are empty. Are some of these governors like being a little overdramatic in terms of what they want from the federal government?
Yeah, there have been a lot of requests, and this president has been very strategic in seeing what the need is, not the ask, but the need. He's deployed resources accordingly, where we can now say that not a single American has died for lack of a ventilator. That's because of President Trump. I mean, this is the greatest mobilization, Judge, since World War II, the greatest mobilization of American society, private sector ingenuity. What this president has done in testing is now the new thing the media is talking about. Well, guess what? This president has overseen the 4 million tests being conducted, more than that, 2 times more than any country on the face of this earth. It's extraordinary.
Okay, good. But let me ask you this, Kayleigh. There's different tests. There's a testing to determine whether or not you have the virus. And then there's a test to determine whether you have the antibody, which apparently is even more available. So which test should people be taking?
Yeah, so the experts have distinguished between these two, and it's really important. The diagnostic test was the first phase of the testing because if you're symptomatic, you want to get that test to see if you have the coronavirus. But moving forward, this antibody test, which has been fast-tracked through the FDA, there are several of them available. This is a game changer because we can see who has had this virus, who is now presumably immune going forward because they've had it, and they now have the antibodies to protect themselves. They're both very important. They serve different purposes, and I'm glad you made that distinction because it's important to note.
But once you find out that you have the antibody, the administration is not looking for anyone to engage in any kind of card carrying or something that says, you know, I have antibodies, I can go wherever I want. I mean, we're not talking about this tracing and tracking, are we?
No, I think what you're hearing is contact tracing. So that's an important component, according to the experts. If you are identified as someone who has the coronavirus, to know who you've been in contact with, so then we can find those contacts and ensure that they can be traced. So that's what the contact tracing component of this is.
All right. Kayleigh McEnany, thanks so much for being here, and congratulations. Happy birthday.